Communication. The number one thing you can do in your practice to build your practice is to communicate better with your patients. As evidence-based practitioners, we often get inundated with the details of our treatments and what we're going to do for our patients and everything they can do to help themselves. However, the number one thing you can do to build your practice is to communicate better, to make it simple to understand what you should be doing, what your patient should be doing, both in and out of the office for the best possible care. Hi, this is Brandon Steele with ChiroUp, and let me explain to you a very humbling moment that I had about 3 years ago. It was an intern that came into my practice to see how we run our practice. He was very unimpressed, extremely unimpressed, so unimpressed that he told me at the end of the day how unimpressed he was with what I did that day. So I sat and listened to him. And he said, I could do everything that you just did. I know how to manipulate. I know how to do myofascial release. I know how to do instrument-assisted manipulation and prescribe exercises. I could walk into your practice right now and take over your practice. And I said, you're right. You know exactly what I did. However, you don't know why I did it and why I only focused on those things. You see, he was under the impression that we had to talk to our patients about what we were doing each visit. We had to explain their rehabilitation exercises. We had to go into deep depth on exactly what we were doing that day and as far as the treatments and the exercises. However, that plan was already laid out well before that intern came into the office. When that patient came in to see me the first time, I gave them the recipe on what I was going to do for them and why it was important, what they were going to do for themselves and why it was important. And that allows me to spend my entire day talking about the 1%. The 1% is the thing that you cannot automate. Those are the things that lead people down this continuum to eventually pain. It's their hobbies. It's their habits. It's the way they sit at their computer. It's the way they throw a baseball. Those are the things that cannot be automated. So I spend my entire time in between evaluations, all those office visits you see a patient, and focusing on that 1%. I don't talk about pops, cracks, did it go, did it hold, how does this exercise feel? That's what my staff is for. That's what my plan is for. That's what my education is for that first visit. Now I get to focus on the hierarchy. The hierarchy is how many habits do I need to change within that person's life and daily routines to help that tissue heal. Because if I can eliminate the stressors, the postural loads, the repetitive stresses, the movements that are leading to that person's problems or limiting their ability to heal, now I have a very satisfied patient because I'm doing the right stuff in clinic, they're doing the right set of rehabilitation exercises, and we're getting creative with their treatment to allow them to heal faster. One thing that people don't see in ChiroUp are the automations. The small little pieces of information that patients can read or watch on a video to help themselves get out of pain. For example, did you know that you can put infographics in all the condition reports? For like gluteal tendinopathy, what you can see here is that after I get down to the very bottom and I can customize this report and give them the best report of findings you've ever seen for a chiropractic patient, at the very end of this, I can add in an infographic on how to sleep. Yes, this helps my patient. That's why I do it. However, it also helps me as a provider. I don't have to continually repeat these things over and over again to each patient with the same condition. Help yourself, help your patients. Use ChiroUp to design a report of findings that not only saves you time, but also improves your clinical care and patient satisfaction within seconds.